So today we're going to talk about baseline testing. Baseline testing is something that's used across the board for a lot of different things in healthcare. However, when it comes to head injuries, how effective is baseline testing? Well, there's a lot of different types of baseline testings that can be used. Some neuropsychological spectrum tests. There's some bedside tests that can be done. There's some computerized tests that can be done on you. It doesn't matter which kind of baseline testing you're doing. Generally speaking, it's usually a very useful tool. However, it depends on when you do it compared to when to your accident or when you suffered from your accident. So when you're playing a sport, it's always good to have a baseline of kind of how you're performing at the starting of that sporting event or potentially that sporting year, so that you know kind of overall where around you're sitting. That way, if something does happen to you where you get hit fairly severely, you can kind of compare that data. Now, is the baseline testing going to be the be all when it comes to being able to help you figure out, do you have a concussion, and what kind of therapy should be performed? So no, baseline testing sometimes there's depending on the test you're doing, depending on who's performing it. That's why it's always good to have someone who's knowledgeable on the subject to perform the test, is because sometimes the tests, well, they're not foolproof. So having a good healthcare provider by your side to kind of dictate or find out, well, maybe you passed this test, but I don't think it's wise for you to continue at sports at this time, is a good idea. In terms of telling you whether or not or how to push you forward with rehabilitation, that's not what most baseline tests are for. Most baseline tests are really just there to say, yes, you are performing at par or you're performing subpar from where you were originally, which means that you should be stepping back for the time being until you're doing better. Some tests that you can use for baseline testing can really be a little bit more helpful, because you can kind of test a little bit more the centralized structures of your head to see how well they're performing from point A to how well they are performing once you have your head trauma. Those tests are super helpful because they actually help you dictate what part of your head might be injured, and that in and of itself will try to dictate how the rehab will go going forward from that point. So there you have it. It's in terms of baseline testing itself, there are plenty of tests out there. They all serve their purposes, and of course, some are always better than others. So it's always just knowing kind of what you're dealing with and what kind of tests you have done on yourself.